Hello again. So we're going to talk today about another interesting topic, which is going to be hernias. So we'll talk about type of hernias and the symptoms they present with, and what's the factor and the aggravating factor, and what things we can do to prevent hernias, and then we're going to talk about the treatment. So the hernias, we have multiple types of hernias, which include the umbilical hernia we have. This is the most common we see in Kuwait. And also we have the inguinal hernia. It can be in the left or in the right. There are other type of hernias, of course. There's femoral hernias. There is Spegelian hernias. There is lumbar hernias. But this is very rare. But the most common one we see every day in our life as surgeon, we usually see umbilical hernia most commonly and inguinal hernias. There is also hernias inside the abdomen, which we call hiatal hernia, which is the hernia around the esophagus. This is a different hernia. The treatment is totally different. It's not the scope of this talk at this point of time. So we're going to talk about the umbilical hernia, what the treatment is available, and the inguinal hernia, what are the symptoms. So let's talk about the umbilical hernia. Umbilical hernia usually present with a bulge around the umbilicus, and usually happen with childbearing women where they have multiple pregnancy. They develop a hernia around the umbilicus, or the patient had surgery before around the umbilicus and they develop umbilical hernia. Some of them they have it congenital from birth. They will have umbilical hernia or above the umbilicus. The patient present with swelling, sometimes pain. Sometimes, if it's a big, can present with obstruction, meaning that the patient present with bowel obstruction, nausea, vomiting, abdominal distension, and the patient seek help emergently. So, if the patient has the hernia, usually we diagnose it clinically. The clinical examination is sufficient to diagnose hernia, and then we can do either ultrasound to confirm it, or we can do a CT scan if it's a big hernia to see how big is the hernia and what the best modality we do to treat hernia. So the umbilical hernia treatment, we do it surgically, and any patient with umbilical hernia, we recommend to treat it because to prevent the complication, which include bowel obstruction or gangrene, or the bowel becomes ischemic when it goes inside and doesn't come out, or the severe pain can the patient have. So the surgical treatment for umbilical hernia is through the laparoscope as well. We can repair the hernia and we put a mesh. Also, open technique is a valid technique to repair the hernia, and most of the time the hernia we use a mesh to prevent the recurrence. So this is the umbilical hernia. Regarding the inguinal hernia, it can happen in the right or the left. And usually the patient present with swelling in the right side, and in the male it might extend to the testicle. And usually the swelling, it depends how big is it, and usually it can be very big or very small. It depends on the size. Now, what's the aggravating factor of the hernia? The aggravating factor is the four things. Either the patient has difficulty in going to the bathroom, meaning that having bowel movement, or the patient has difficulty in urination, or the patient is his work that he's lifting heavy objects, or the patient has a chronic cough, the smoker guys. So if the patient has these risk factors, this is risk of hernias. So if the patient has change in bowel habit, we always recommend to do colonoscopy before you do the hernia, because if you do the hernia and the factor did not resolve, the recurrence will be high. Also the same thing, if the patient has urinary problem, he should seek help to treat the urinary problems to prevent straining. If the patient lifting very heavy object, he has decreased the amount of lifting. And if the patient has very bad cough, he has to treat the cough or to seek help to treat cough. Because if you don't treat these factors, the patient, he might have a recurrence. Even with the putting mesh to prevent recurrence, there is a higher chance of recurrence of the hernia. Now, how we treat the hernia in the inguinal region? We can do it open technique or laparoscopic technique. We prefer laparoscopic because the pain will be less and the patient goes to his life quicker, and we can do both sides, left and right, in the same incisions we use. So we don't have to cut twice for the patient who has left and right inguinal hernia. So the hernia, this is can be done laparoscopically and open. So this is in brief about the umbilical hernia and inguinal hernia and how to treat them and what the modality is available, and treated now laparoscopically. And most hernias require mesh, and the mesh is very important to prevent recurrence. But also is very important regarding the hernias is the aggravating factor. We have to eliminate the aggravating factor, which include, as I said before, chronic cough, difficulty in urination, difficulty in going to the bathroom, and constipation, and also of somebody who's worked with heavy lifting. So this is briefly the hernia. We finished from the first part. We'll have a break and go to the second part. All right, welcome back. So let's go back to the hernias, and the other type of hernia we call it is called incisional hernia. This is incisional hernia where the patient has actually big surgery, where either due to maybe he has trauma, for example, he had a car accident, or maybe he has other disease in the liver, in the pancreas, in the bowel, in the small large bowel, or maybe has surgery for his kidneys, or maybe he had transplant. Any type of surgery happened to the patient where he had a laparotomy, meaning that the patient's abdomen is open, either big or small. Now the patient in this situation will come with a bulge. The bulge usually big and causing discomfort, and the look is very bad because it looks like another abdomen is out. And the patient has also symptoms which include pain, might have difficulty in going to the bathroom, bowel obstruction, and sometimes even develop nausea or vomiting because of the hernia and because of the bowel that's sticking out of this hernia. Now, this type of hernia is a little bit complex and has to be treated properly to prevent recurrence. What do we do if we have a patient with this type of hernia? We have to work them properly. If they are elderly people, we have to do all the investigation of the bowel, which include colonoscopy. We have to make sure the prostate is okay, there is no problem with the prostate or urinary problems. And then we have to do a CT scan of the abdomen to give us a roadmap for how we treat this type of hernia. Because the defect, how big is the defect and how big is the hernia will decide what approach we can use to treat this hernia. Now, what modality we have to treat this type of hernias? We can do it laparoscopically and open technique. The laparoscopic technique usually used to take the bowel down. We do adhesolysis first, and then we can close the defect from the inside the abdomen. After enclosing the defect from inside the abdomen, then we apply mesh, and the mesh, this is very crucial, and we tack the mesh in the abdominal wall. This is first of all to prevent hernia, to give you a solid, strong repair, and the patient has a higher chance that he will not have recurrence in the future. Laparoscopic hernia, ventral hernia repair, or incisional hernia repair is a valid options, is a good options, with a less pain post-operatively. Now, if the patient hernia is so big, or it can't be done by laparoscopy because the patient lost most of the muscle, an open technique is another approach. What we call it a component separation technique. Component separation technique also can be done laparoscopically, but main component separation described first as an open technique, where we can separate the muscle of the abdominal wall and approximate them together, and we can do a sandwich way of putting the mesh. We can put the mesh underneath and above the muscle to strengthen the muscle wall. By doing this, we can treat the hernia, and at the same time we can prevent recurrence, and at the same time we're giving the best chance as a cosmetic for the patient. So the ventral hernia or incisional hernia is a hernia happen after an incision made in the abdominal wall, and usually the patient present with a bulge, a big bulge, or abdominal pain, or sometimes even nausea or vomiting. And the treatments available is through the laparoscope and through the open technique. Both technique is valid. Both technique you have to use a mesh, and both technique give you a good cosmetic result. Thank you.